A new program from Governor DeWine and the Ohio Department of Health is making sure children who need vision care actually receive it. That program is called Ohio See. Good evening and thank you for joining us for NBC 4 at 11. I'm Kerry Charles.
I'm Kyle Beachy. Colleen is off tonight. Ohio See is aimed at making sure students have not just a vision, but literal vision for their education. Here's NBC 4's Delaney Ruth.
$10 million of the state budget is going directly to the new Ohio See program, which will operate in 15 high-priority counties, including Franklin County. The director of the Ohio Department of Health says Ohio has a gap in vision care for kids.
Only a small percentage of kids who are identified on a screening exam as being someone who needs a more complete eye exam and potentially eyeglasses goes on to get that more complete exam. It's less than a quarter.
Ohio See will fund mobile vision vans and temporary in-school vision clinics, which will bring eye exams directly to schools and students. ODH Director Dr. Bruce Vanderhoff says the program will serve kids from kindergarten through third grade who have failed a vision screening.
What we'll be doing in those counties is bringing follow-up exams to any student who needs that follow-up exam after having failed a vision screen at school. And if they need a pair of glasses, they'll get them.
I also spoke with Dr. David Rogers today, the head of ophthalmology at Nationwide Children's Hospital, and he says he sees the gaps in care.
Kids may be screened in school, but then they are lost. They're referred for an eye exam, but they never get to the eye exam.
Dr. Rogers believes the Ohio See program will provide solutions to the barriers many parents face.
They don't have access, they don't have insurance. Parents aren't available to do it during certain specific business hours that most ophthalmologists and optometrists keep.
Dr. Rogers says around a third of kids need glasses, and without access to vision care, kids could fall behind in school.
You need to be able to see, to read, and write. Our whole system is based on being able to see and read, and I think the governor has done a good job identifying the problem. So they've identified the gap, and they've proposed a solution.
The Ohio Department of Health says they expect Ohio See to serve around 14,000 kids a year once the program is fully implemented. They'll start rolling out the program in early 2026. Local for you, I'm Delaney Ruth, NBC4.
Thanks for watching. For more NBC4, download the NBC4 streaming app. You'll get free 24/7 local programming streamed straight to your living room. Just search NBC4 Columbus on your Apple TV, Amazon Fire, Roku, or Samsung device.